Hey, so if you're watching this video, I'm guessing that you're a physical therapy private practice owner and you're looking for some really good ideas how to market your private practice. And what I have for you here is a list of the top ideas that we've ever used right here in the trenches of private practice physical therapy in one of the most competitive markets in the country, right here in central Pennsylvania, but how we've marketed our private practice. And in spite of all the recent healthcare trends and healthcare pressures, where we went from when I started practice to not even having direct access, to now that over 80% of our total new patients every single month are coming to us from direct access, I thought I'd share with you some really clever ideas that you can implement and get started with today. So the first target market that we're going to look at is the general public, and here we're talking about direct access patients. So this is really sexy right now to talk about, and it's a hot trend because as physical therapists we've wanted direct access and it was the destination for us, but we weren't necessarily sure how to use it, and I think a lot of us are still trying to figure that out. And so I listed here the top 7 ways that we've used direct access patients, and I can just tell you from experience right now, within the last 12 months we've had patients fly here to Harrisburg, Pennsylvania, from Montana, from California, Lexington, Kentucky, Atlanta, Georgia, and now we have somebody flying up from the Tampa area, Tampa, Florida, just for treatment. And you can do that same thing. So the number one most powerful tool to attract direct access patients that we found is workshops. And again, just to give you an idea of how powerful they are, 2 weeks ago I ran a workshop here. We did Facebook advertising only for it, and I know I'm making that sound really easy. It is a little bit more sophisticated than what you might imagine, but we had 35 people register via Facebook for that live back pain and sciatica workshop. Fast forward to this weekend, I have another one scheduled, and this time we have 43 people scheduled for the back pain and sciatica workshop. So if you're looking for a good idea in terms of how to attract new patients, specifically direct access patients from the general public, so they're completely, it's cold traffic, they have no idea who you are, they're not past patients, and they're not referred to you by a physician, the thing that you want to focus on and learn how to do is workshops. Moving on to the second target market, we have patients. Now, to me, this is your most valuable asset, is your past patient base, because people that have already been treated by you, they know, like, and trust you the most, and you should get your greatest return here. And you know, really quick and easy, there's 2 ways that you can measure how well you're doing with your past patient base. The first number is past patients returning to you for additional care. So maybe they saw you for back pain a year ago, now they're coming to you after their total knee replacement. Or maybe they saw you for back pain a year ago, now they had an exacerbation, they're coming back to you again for another episode of care for back pain. The second thing, the second way you can get new patients from your past patient base is they can refer other people. And the best way to do that I found is a newsletter. Now, I've been doing a newsletter for over 12 years now, and I've invested over $1 million in newsletter printing. So you know, in this case, I definitely put my money where my mouth is, and this is the main driver for our entire business. If we wouldn't have had this, we wouldn't have been able to weather the storm with, like, POPS practices springing up, and in our area, hospitals, 3 local hospitals employ now more than 70% of my referral sources. Most of them I can't even get in to see right now and talk with, even though we've likely treated them or one of their family members. So we've treated a lot of local physicians, but they can't even refer to us anymore. The reason that we've been able to survive that and weather that storm is the patient newsletter. So I would figure out how to do that as well. The third thing that we're going to talk about is physicians. Now, I've heard some, like, so-called physical therapy marketing experts who usually aren't in our market, that, you know, usually aren't physical therapy practice owner dealing with this, but they'll say, like, this is dead. And guess what? This is a big button. I myself have experienced a huge decrease. In 2007, we hit a high of 154 physician referrals in a month, and in any given year, just to give you an idea, we've always been, like, really wide. We've had over 200 referral sources on average in any given year. Recently, we just hit a low of 29. So we went from 154 down to 29. But guess what? That's still 360 referrals a year on average is what we're getting from physicians. So even though the hospitals employ almost everybody, what's happening is almost every private practice practice is just ignoring the physicians now, saying things like, and this is dumb, it's dumb to say this, like, we can't even get in to talk with the physicians anymore, I just give up. So there's other ways to get through, and you want to figure out what that is and what they are. And the most effective way that we've learned is something we call the Top 3 program, and I grabbed it here. By the way, I'll show you some of the other marketing stuff that we do as well if you're looking for more ideas. But like this, we got from just surveying physicians. And we said, hey, if I would come to you with back pain, what would you do for me? And they would say, well, I'd hand you an exercise sheet. And I looked at that exercise sheet, and it was like a 1977 AMA handout printed on pink paper. Like almost every physician in our area had this, and it had 9 lower back exercises on it. And PT talk, really quick, shop talk here. 3 were Williams flexion exercises, so were kind of appropriate for like stenosis or arthritis. 3 were for like SI joint and pelvic instability, so they were more like core strengthening, transverse abdominis multifidus activation. And then the last one was mainly extension exercises, in particular seemed to be for disc herniation. So I said, well, which ones would you give me? Just seeing if they did any sort of differential diagnosis. And they said, well, like I would just tell you to do all of them. And then I just walked through and I said, hey, like if I could create like a brochure for you for the person who's like 50 years of age or older, they have pain with standing and walking, relief with sitting, and they likely have stenosis on an x-ray, would that be beneficial? Yes. So we did this. It's called Top 3 Exercises for Lower Back Pain for Arthritis, Disc Degeneration, and Stenosis. And you know how we typically as physical therapists, we have that trifold brochure we're really proud of? Like this definitely put us on a map, and I'll share with you in a second how powerful it's been for us. Then we have one for Top 3 Exercises for lower back pain, pain bending forward, herniated disc, sciatica. And then Top 3 Exercises, home exercise for lower back pain, pain with sitting, getting in and out of the car, rolling over in bed, SI joint pain. Now, why would we want a physician handing these out? One, realize this, they're not referring to us nearly as many patients as they should be anyhow. The second thing is we're really looking for a relationship with the patient who feels like they've stumbled upon us, more so than the physician making the referral. So at least in our area, I've talked with doctors and watched how they've made a referral. They're not really strong. It's not the strongest skill set. So they're much more likely to hand a brochure. What I'm looking for is a reader, somebody who's going to take that, and then what we do is in the middle here, when they open this up, and by the way, this flies under the hospital radar, so if you work in an area where the hospitals won't let you in, doctors can hand this out, and the doctor doesn't get in trouble at all, because he or she they've not really made a referral. They just handed, like, you've helped the doctor do a value add with the patient. It makes the doctor feel smart, makes the patient feel smart, and then what you do is on the inside, you have a little call to action right here where you drive them to learn more about their condition. And you know, that's a whole other conversation. Again, the purpose of this video is just to give you some ideas on what you can do. I want to share a couple other things with you here that we've done. Another one like that we've done, which it just came from talking with patients, is right here, number 7, exercise cards. So rather than hand out an exercise sheet, every patient that comes through gets one of our little carabiners. You can do the same exact thing, and then we have about 300 different exercises on exercise cards, so we can add and take away as a patient progresses. Something else that we've done is I have 3 different versions of what's are really 2 books here. So this came from doing the workshops. We had people who requested that I take that material and put it in book format. So this is the older one. I only have 1 copy of this left, and this is it. So we went through 1,000 copies. Pain-free motion for your lower back. And then the more recent one, which is now on Amazon, is called Back to Normal. So pretty cool stuff. Also grabbed, yeah, these are like a sample of some of the reports that we do that have worked really well for us. Tracking patients, top 10 most burning questions for sciatica, and then revealed 5 secrets to avoid back surgery. And in this we have like stories of people who've obviously traveled in, like the gentleman from Kentucky. And then I just grabbed a sample of our most recent newsletter for our an example of our patient newsletter. So this should give you an idea of how you can market creatively if you're looking for ideas to market your your physical therapy, specifically if you're in private practice, exactly as we are here. If you want to learn more, there should be a link below this video. Click on that link and I'll share more ideas with you about how you can successfully manage the current healthcare trends and how you can really get ahead, take your private practice to the next level. Click on the link below.